This is Seraphina, the FIP cat. I caught her about 4 months ago. Her and another cat looked like they were dumped at McDonald's, and she was living under a sidewalk for a couple weeks. I caught her, brought her home, put her in my garage with the other cat, and over time, other cats came in here. I try to keep them separate from the others, but um, what happened was I caught two dogs and had no place to put these dogs, so I put them in this garage where Seraphina and a few of the other cats were living. And I had to put Seraphina and the other cats in the house with all my other cats. So after about 2 weeks, I finally got the dogs at a rescue, which was a total nightmare. 2 weeks of hell, basically. So in the meantime, Seraphina was, in the house, but I noticed she was losing weight, so I thought, oh, she's just stressed out from being relocated, which was true. But what I didn't know was it triggered a mutation because she had COVID, which I didn't know she had. And now all my other cats probably have COVID because of her. But it mutated into FIP, which is rare in cats, but it happens. And it's 5 years ago, this is a 100% deadly disease. And I didn't know much about it, but I noticed when she started losing weight and her hair got really bad and her belly, once I saw the belly start to get big, I got really concerned. So I took her to the ER, and there is no real test for it, but there are markers like physical things like her belly, weight loss, and certain blood work markers would indicate it. So I got her on the FIP medication 2 days later, and she's improved greatly. Without it, she'd be dead. She would be dead right now. No question about it. She would have died probably 2 weeks ago, to be quite honest with you. So it's a miracle drug. Like I said, it used to be a 100% death rate. Now it's about a 15% death rate. It is a long process. It's in 84 days of an oral antiviral. But what I'm saying is this was triggered by stress from her being in the house with the cats and her not in this garage. So anyway, I was waiting to actually go through a rescue. It's called surrender to foster. And I finally had the green light to take her to the foster, or take her to the rescue, so I can foster her through them. Which is crazy because I've already had her for 3 months at the time, and I already had her fixed because I couldn't wait any longer. I didn't want her to get pregnant, or I was afraid she might even be already pregnant. So I got her fixed, I got her vaccinated, I got her tested. And so what happens with this particular rescue, when you surrender them, like in my case, I surrendered to foster. All she needed at that time was deworming, rabies vaccine, and a microchip. So they finally told me, yes, on Wednesday bring her. But on Saturday, I thought, I got to bring her into the ER because she was looking really bad. I didn't want to wait 3 or 4 more days. And if I didn't catch those dogs, she wouldn't have mutated into FIP, guaranteed, because of the stress. So definitely stress will mutate that COVID gene into FIP. So here's my concern is the rescue said they won't take her, so they turned their back on me. But they told me, which gets me, is they said they're not equipped for an FIP cat yet. I'm just a homeowner with 25 cats in my house. I don't have a full-time vet on staff, and they're who's more equipped, them or me. I would say them. And not only that, she was scheduled to go in for intake, and I even told them she was sick. That didn't stop them until I told them that she had FIP, that she might have FIP. So they turned her back on me. But they said after the 84 days, that I could bring her in to intake to surrender to foster. I'm like, okay. After I spend another $1,000 on medication, you'll finally take her. I mean, I've already spent probably $4,000 on her just in the last month. Most of it from the ER. I had to take her to urgent care to get her belly drained. But ever since then, she's been fine. So my concern is when she's up, when she's got her 84 days of antiviral medication, I'm going to take her to the rescue, and what'll happen is they'll look at her and be like, okay, she looks good, blah, 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 and then they'll give her rabies vaccine right there, and microchip, and then they'll send her home. Oh, and they'll give her a dewormer, and they'll send her home with me with probably 2 more doses of the dewormer, and I'll give her another dewormer after 2 weeks, and then they'll probably take her in at that point. So then I would actually surrender her to them, and they can get her adopted. Now, my problem is her being there at the rescue. I would be concerned because I don't want her stressed out. So I don't know if they would let me just keep her here and get her, post her on there. They've never done that. Or I should just do this all myself and try and find her a home. I don't know. I don't want to take her there because I don't want her to relapse. It's a very slim chance of relapse, but I could just see it happening to her. She'd be the unlucky one. So, Seraphina needs to find a home. I live in Arizona. So it's going to be a challenge. Because, if I can get her a home, a nice quiet house where she's the only cat, she's not going to have any relapse. It'll probably stay dormant probably the rest of her life. I mean, it could happen again, maybe when she's older. But, it could be 10 years from now. Or who knows, longer. And maybe at that point there's even better medications. Or whatever. Although this one's pretty good. But you know what I'm saying. So, Seraphina, come here. Come here, girl, come on. Come here, Seraphina girl. I mean, I really don't know what kind of pet she would be actually inside the house. When she was in the house for the 2.5 weeks in my house, she was usually under the couch because, like I said, there was a couple of cats that gave her a hard time, and she would kind of zip around the house. Although I remember, it seems like the first 2 weeks, she was just sleeping on one of the couches in the room, no problem. I was like, wow, she's doing good. And then all of a sudden she would disappear and she would be under the couch for like 2 or 3 days. That's what I noticed. she wasn't looking good. So it was definitely brought on by stress, the mutation into FIP. So, like I said, that's my main concern. So I need to somehow get her adopted on my own, or maybe work out some kind of deal with the rescue where I could just keep her here. I'm not real sure how that's going to work out. Maybe just show me how to do an adoption. I don't know. I really don't know. Or shit, everything's freaking electronic. Anyways, like, come on. I don't know. But she deserves it. She deserves this chance. And I really like her. Come here, girl. Seraphina, girl, come on. Come here, girl. Hey, come on. Anyway, it's getting late. Peace out.